You guys right to go? First things first, there are 19,767 confirmed aggregate cases of coronavirus since the beginning of the pandemic. That's 43 new cases since yesterday. Sad to say there are now 710 Victorians who have passed away because of this global pandemic. That's an increase of 9 since yesterday's report. 1 female in her 50s, 1 female in her 70s, 3 males in their 80s and 4 females in their 90s. 7 of those 9 deaths are connected to outbreaks in aged care. We of course send our sympathies and condolences to each of those 9 families. There are 140 Victorians in hospital, 12 are in intensive care and 8 of those 12 are on a ventilator. A total of 2,456,924 test results have been received. That's an increase of 13,341 since yesterday. Again, can I thank those more than 13,000 people who went and got tested about 24 hours ago. Can I just again ask on behalf of all Victorians, and getting through this quicker, can I ask anyone in Victoria who has symptoms, no matter how mild those symptoms are, please come forward and get tested. There's more than 200 test sites. The results, 90% of the results are coming back within 1 day. It's a massive contribution that you can make. It is essential to us having the clearest picture of how much virus is out there and moving through these safe and steady steps towards a COVID normal. We've got to keep those numbers as high as we possibly can. Any symptoms whatsoever, please come forward as soon as those symptoms begin. It's a simple thing, but it makes a massive difference. So anyone who, for whatever reason, can't get to a test site, we will come to you. We will visit you and make sure that you can be part of that testing program. It's so important. There are 4,303 cases with an unknown source. That's a decrease of 3 since yesterday's report. There are 223 healthcare workers who are active cases. We send them our best wishes and we thank them and all their colleagues for the quite amazing work that they do every single day. There are 1,336 active cases in Victoria, so those numbers continue to steadily fall. In terms of regional local government areas, so regional Victoria under stage 3, there are 74 active cases. So again, low numbers in regional Victoria and they remain low. The Colac has 33 active cases, so 4 new there. Greater Geelong has 10 active cases, 1 new. Greater Bendigo, 2 active cases, 1 new. And Ballarat has no active cases. The rolling average 28 August to 10 September, Metro is 65.3, regional Victoria is 4.7. So regional Victoria is poised to take at least a step and potentially 2 steps. We'll have more to say about that next week as we get closer to that 14-day marker as we had indicated. But again, it's an opportunity for us to say thank you to every single regional Victorian in a big regional city to the smallest of country towns. They're doing a mighty job in coming forward, getting tested, following the rules, and that's why we've been able to drive these numbers down. As I've said a few times now, you can't possibly hope to open up and keep numbers low if you don't first get those numbers low as you possibly can. That's exactly what's occurring in regional Victoria, and there is great cause for optimism and to be hopeful that what's happened in regional Victoria is proof positive that this strategy can work, is working and will continue to work. And that's something that's not just important for regional Victoria, but I think it sends a really clear message to people in Metro Melbourne as well, that it is possible to drive these numbers down to a very low level and then keep them low. And that's the experience in regional Victoria over recent weeks and months. In terms of aged care active cases, there are 665 active cases in aged care. Again, those numbers continue to fall, and that is a testament to the efforts of many, many people to bring that sector under some sense of control to deal with the very real crisis that we had in a number of settings. In disability facility settings, there are 13 active cases, 7 staff, 6 residents. We know how vulnerable those cohorts are, so again, pleasing that those numbers are stable and indeed falling. The other couple of things I wanted to do today, just before I ask Jenny to speak to hospital presentations and some worrying trends in terms of people not presenting to emergency departments when they have symptoms for things that really can't wait. So Jenny will speak to that, and of course Alan will speak to the epidemiology of the day and take questions. But before I do that, I just wanted to, I think you're going to be, if you're not already, you're going to be made, you will receive some latest information in relation to traffic movement as it relates to the hours when the curfew is on. What I can say is that there was an immediate and pronounced and indeed a sustained drop in road use in all metropolitan local government areas between the hours of 7 and midnight, again between midnight and 6 a.m. Some not quite as big a reduction in some of the outer suburbs, but our data analytics team are pretty well convinced that relates to key workers moving within those suburbs, and not just, I shouldn't say key workers, those who've got a permit and are allowed to be at work. But what it shows you is quite a massive drop in the amount of movement that we've seen right across Melbourne while ever the curfew has been on. And what's clear, if you can limit movement, you will limit the spread of this virus. If you can limit movement, then you will see less people doing the wrong thing. It's much more easily enforced by Victoria Police, and what's more, you get the case number reductions that we're all after. That's exactly what we want. That's what we're working towards, and that makes opening up possible, and it means that it happens much, much sooner. I think Victoria Police later today will be out to talk about some of those matters, and I'll leave it to them to speak about what are, in many respects, operational issues. Just before I throw to Jenny to go through some of those ED issues and hospital issues, I just wanted to take you through the latest snapshot in relation to contact tracing. This will be up on the website, but I just thought it's important to read some of these out. So for the week to 8 September, the percentage of new positive cases contacted within 24 hours, 100%. The percentage of new positive cases interviewed within 24 hours, 92.3%. As we've always said, there will be a very small number of people that we just can't find within that 24-hour period. That's where the door knocking comes into its own. That's where repeated phone calls, lots of hard work, old-fashioned legwork to make sure that we can ultimately get to those people. But the metric is, the performance is 92.3%. Percentage of known contacts notified within 48 hours, 98.3%. And again, there will be that very small number of people who you can't find just because numbers are incorrect, addresses may be incorrect, all of those quite understandable reasons. If you look at data for the week to 1 September, again, positive cases being contacted within 24 hours, 100%. Percentage of new cases being interviewed within 24 hours, 91.9%. And the percentage of known contacts contacted within 48 hours, 98.4%. So that is a testament to the work that a very large team is doing. And in some of those measures, just 1 week to the next, there is, even off a very high base, there is still some improvement. We'll continue to try and drive those numbers right the way up to 100% in each of those categories. That is challenging, of course, for the reasons that I've mentioned, but it is a testament to a very big team that are working very hard to make sure that we have the best public health response and recent outbreak responses. Just to give you one example, Colac, for instance, is a very clear sign that that team is working hard and is delivering very, very good results. And I want to congratulate the Colac community for the partnership, for the way in which they've worked with our public health team out of Barwon Health to pull that up at 25 to 30 cases when it could have been so many more. Is a great testament to the work that they are doing. Of course, we'll keep looking for other ways to improve. Minutes matter, hours matter, and if they can be found, if we can become even more efficient than we are now, of course we stand ready to do that. Having said that, I just want to perhaps end my comments by saying I think that there's every reason for Victorians to be positive, for Victorians to be hopeful about the fact that what's occurring in regional Victoria, they're on the cusp of not just taking one step, but potentially being able to take 2 steps. That just shows you that this strategy is working, and what we've achieved in regional Victoria, we absolutely can and will achieve in Metropolitan Melbourne. But it has to be done right, it has to be done safe and steady. As I said before, you can't possibly hope to keep numbers low if you don't first get them to a very low level. Otherwise, you do run the risk, the very real risk, in fact the likelihood, that our opening up won't last very long and then we'll be all locked up again, and everything that Victorians have given, all the amazing sacrifice, all the amazing hard work that Victorians have done across the board for many months now will count for nothing. I just don't think we should go down that path. I'll now ask Jenny to speak about some of the trends in hospitals and some really important messaging about people not putting off care. Hospitals are safe, our teams are working as hard as they can, and there's no reason to put off care, that particularly time-critical care. Jenny.
Thank you very much, Premier, and good morning. Firstly, I too want to thank Victorians for the amazing work that they have all been doing. It's great to see the case numbers continuing to decline, both today and in recent days. It's important that we continue at this effort to support each other at this challenging time, so we can continue to bring hospitalisation numbers down as well, and also to see fewer tragedies playing out. I want to express my sympathy and condolences to those families who've lost a loved one in recent days. It's important that whilst we remain vigilant against coronavirus, that we don't neglect our other health needs. My health services are reporting that there are declining and concerning attendances at our emergency departments, and this does suggest that people are putting off seeking urgent and important medical care that could make that critical difference to their life. Our emergency departments, for example, are reporting significant declines in presentations at a time of the year where typically they are at their busiest. The month of August is typically a very, very busy month for our emergency departments. They're usually in the peak of the flu season. Our flu numbers, thankfully, are significantly down this year compared to the last 3 years. They're down about 80% compared to the last 3 years average. But it's clear that people are deferring important medical care for very serious conditions. So, for example, presentations to our EDs for heart attacks are down 18% compared to this time last year. For strokes, they're down 24% compared to this time last year. And also people are deferring important cancer screening, which has meant that we are seeing about a 30% reduction in reports for the 5 most common cancers: colorectal, prostate, breast, melanoma and lung cancer. So this is very concerning because deferred care can lead to worse health outcomes. It can lead to much longer hospitalisation stays. It can lead to tragedy. So we are urging Victorians today to continue to visit their GP, to take their regular medication, and if they have any lumps or bumps or symptoms that they are concerned about, to please do not defer seeking medical care. That may well mean turning up to an emergency department or calling 000 if you have symptoms of concern. It is important that you continue to seek that medical care. It may, in fact, save your life. So we have had other opportunities for people to seek important care. I want to stress that our hospitals are safe for people to attend. We have had a significant decline with a great deal of effort from health services in healthcare worker infections in recent weeks, and we have actually now only 227, I believe, was the most recent number of healthcare workers being furloughed in our health services. So there has been continued efforts to address these issues, but our hospitals are safe for people to present to. They are utilising telehealth technology. We've had a very significant increase in the use of telehealth. So compared to 4% of specialist clinic appointments in the 2018-19 year that were using telehealth services, approximately 46% of those appointments are being conducted through telehealth now. All of our health services have embraced this technology. So at the Royal Children's Hospital, for example, they have been utilising about 70% of their clinical consultations via telehealth. So people are able to access those important appointments through using that technology and doing it in the comfort and safety of their own home. Compared to The start of the year, about 2,000 conference calls or video calls through telehealth were being utilised by health services. In the month of August, this was up to 60,000 such appointments. So whether it's speaking to your GP, and that also can occur through telehealth technology, or speaking to our dedicated healthcare workers in our hospitals through telehealth, or presenting to an emergency department, I would urge Victorians not to defer important medical care. It's important that we remain vigilant against the coronavirus, but it's also important that we similarly remain vigilant to all of our healthcare needs. Please keep taking your medication, speaking to your GP and other medical specialists, and please do not put off attending one of our emergency departments if there is anything that you are concerned about. Thank you.
Thank you, Minister. I just wanted to add a couple of points before we go to questions, and if anyone's got any questions for Alan, of course he's happy to answer them. In relation to sacraments at the end of a person's life, I know and understand, the government knows and understands how critically important that is for many people of faith and their families. There was a little bit of confusion about this. We will have some updated frequently asked questions and some other details on the website very, very soon. Under the care and compassion grounds, it is completely permissible for you to have a minister, a priest, whomever it might be, a rabbi, whoever it might be, to come to you and administer those end-of-life sacraments. There will be always some finer details in relation to the way individual hospitals have got their own rules in place. Those rules are there for the best of purposes. They're there to try and protect staff and protect fellow patients. But in the broadest of terms, last rites and similar sacraments are in fact allowed, and we obviously apologise if there's been any confusion about that matter. I have, in a broader sense, I've been in contact with Archbishop Comensoli this morning, and I just wanted to make the point and send a message to people of faith, all faiths, right across our state. I know that 2020 has been a very difficult year. The notion of being able to connect, to share that important part of your life, to be part of that network in a very tangible, physical sense, to be in the same space together, celebrating all of those things that you hold dear, those things that are core values for you. That not being an option, that not being a feature of 2020 for so many months is a really significant issue. And I want to thank all of those multi-faith leaders who have engaging with us so well on so many different issues. And we know that there are some Jewish high holidays coming up quite soon. We're working closely with that community to make sure that those celebrations can be, those important occasions I should say, are as close to normal as they can be. The key point here though is that this virus doesn't discriminate. You've got to be as cautious as you can be, and we've got to try and put in place sensible rules, compassionate rules, but it can't quite be normal. It's got to be COVID normal, something that's as safe as possible. But I did think it was appropriate to try and acknowledge, on behalf of the government, on behalf of all Victorians, that we know and we deeply appreciate that for people of faith this has been a very challenging year. The best thing we can do though is to stick together, to look out for each other, to follow the rules, and take these safe and steady steps, and then find that COVID normal, so that Christmas and 2021 is a very different year than 2020. Happy to take any questions you have.
Premier, you've said all along that you're trying to balance a public health response to the virus and also trying to balance that with the health effects or the adverse health effects of keeping people in lockdown. 25% reduction in emergency department admissions, wouldn't that suggest that balance is off?
No, well, I think it would suggest that many people are making decisions. We don't think they're the right decisions, and we're urging people to make sure that they don't make any choices that make their health challenges worse. I think that we can drive those numbers up. I think it's just a matter of trying to reinforce the message to as many people as possible that just because we do have this very serious challenge and we do have rules on that are absolutely essential, if you need care, you've got to come forward and get that care, and we'll provide that to you. And look, I know enough about our health system and enough about the people who work in it to know that they will take extraordinary steps to make sure that they safely provide care to every single person who needs it. So we'll continue to get that message out there, and we'd obviously be grateful if you can help us with that. It is about saying to people, you can't put off going to the ED if you've got symptoms compatible with a stroke, symptoms compatible with a heart attack, even a minor heart attack. You've got to go and get that care, and you can be confident that all the team at all of our hospitals will give you the care that you need, and they'll do it in a safe way, a COVID-safe way. That's the really important message.
Wouldn't it be odd if you had a heart attack or a stroke and didn't go to hospital? Is that to say that we're having fewer heart attacks and fewer strokes?
No, I think what it says is that some people are putting off going, and I think we've got someone who is in exactly that position who you'll be able to talk to later on today. We haven't got them here today, but I think they'll be available to you. Someone who had some symptoms, they put off those symptoms, put off going to the hospital. They ultimately went, but they went later than they probably should have, and luckily they were able to get the care they needed really quickly, and it didn't have such a big impact. But time is everything when it comes to stroke, when it comes to cardiac issues, and we're just trying to send that message to every single Victorian. The staff are the best in the world. They will provide you with the best care, and they'll do it in a COVID-safe way. So please, no one should be putting off getting care, getting the really important assistance that they need. That's absolutely the clear message, and hopefully that gets out there to people, and then we see some of those trends change.
Can we maybe ask Alan just
Certainly.
about, I guess, the numbers coming down and the percentage of mystery cases? How many of today's are potential community transmission?
So they're not, obviously, when we first find out about them, we don't know exactly where they are, so they're under investigation. But of the 43 cases today, 16 are linked to known outbreaks. Of the others, they're still being investigated. The unknown source ones, actually, there's a decrease of 3 because there's been investigation and they've closed those ones out.
And how are things looking in regional Victoria in terms of
Yeah,
mystery
we've
cases?
been looking at this really closely. So, as Premier mentioned, the average over the last 14 days is 4.7. The unknown cases in the last 14 days in total is 7 cases. Of the ones that have been diagnosed yesterday, so there was one in Geelong that was a contact of a known case, one in Bendigo that was part of another a family cluster, 4 cases in Coal Lake, which again was part of a cluster. So all of those are known cases and known origins and not unknown source. There was one in Echuca yesterday that we're looking into a little bit more closely. So a case was reported from Echuca yesterday. We haven't had any cases from Campaspe for quite some time. There's a specialist team that's being a specialist committee that's been stood up to look at the details of that a bit more closely, and there's some ongoing testing. So that hasn't been confirmed completely as yet, and there's going to be some more thinking about that to see if that is indeed an unknown source. I think what that means for people in Echuca is that if you do have any symptoms, please go down to the Echuca Regional Health Centre, I think it's in Mitchell Street, and please get tested while we're still trying to work this out. And I understand we've also been talking to our colleagues in Albury local health district in New South Wales to stand up testing on the Marama side of the border as well.
Those are completely random cases here and there.
Yeah, so that's why we're looking into it a lot more closely. There are some features of that are a little bit odd, so we're standing up an expert committee to just look at the details of that case a bit more closely before we conclude on whether it's a case.
What about it, do you think?
Probably don't. So there's retesting going on of the case, and we haven't had any other cases from that area. There's no known contacts between that person and any other case, so I guess there's some of the features that are making us look a lot more closely into it.
And if you can't find any known where it came from, that means it's at least obviously 2 weeks before the regions can move to that next step.
But again, there is a bit of judgment in this, so we will need to look at this case very carefully, clearly.
How many healthcare workers and aged care workers are part of the 43 cases?
So what I can say in the last week of the 385 cases in total, 89 have been healthcare workers. Of those, 55 are known to work in aged care and 4 in hospitals. And obviously, there's a few that we don't know, the details yet. But just reminding that healthcare workers are a broad group and do include aged care workers, and that's where probably about 70% of healthcare worker infections are.
So do you have the overnight tally?
No, I don't have that off the top of my head. No.
Premier, just back to religious-related things. You've talked about as normal at Christmas as possible. Obviously, we're seeing things like the Myer windows being cancelled, so it's not going to be that normal.
No, it's not going to be a normal Christmas, but we want it to be. We don't want it to be a lockdown Christmas. We want it to be a Christmas that can be as close to normal as possible, a COVID normal Christmas, and that means it'll look different in lots of different ways. But the aim is to take these safe and steady steps and find that COVID normal and have a Christmas that's much closer to last Christmas than it otherwise would be. It's going to look different in lots of different ways, but we've got a clear plan. The regional experience shows that it is working. It'll continue to work in Melbourne as these numbers come down. It's 5 weeks ago, 725 cases. Today we've got in the low 40s. Now we've got to keep that trend going, and the key point there is get tested, and get tested as soon as you have any symptoms. And all of us keep following the rules, as challenging as they are working. And that'll get us a Christmas that is not a normal Christmas, but a COVID normal Christmas. And many of these rules will seem a long time ago because we will have moved to a very different set of rules by then.
We haven't talked about New Year, and I guess it's still a long way away, but the chances of having 500,000 people in the city for fireworks for New Year's Eve
would be very low, I would think. Very low. But again, the key point here is, it's hard with any certainty to predict a week or 2 weeks. We do our level best to make sure that we've got as many inputs into the modelling. We've got, many different people testing all of our thinking, making sure that we've come to the right sort of conclusions. But it is New Year's Eve is a long way off.
There's been some concerns this morning. I think Woolworths has expressed some possible food shortages around Christmas time. Is that something you've heard about or are you worried about?
A couple of points, Candice. I want to congratulate and thank Woolworths, Aldi, Coles, all of those supermarket operators that have worked so closely with us for months and months now. I'm very grateful for the very positive partnership that we have with them, and if I can, on behalf of all Victorians, I want to thank every supermarket worker out there who's done an amazing job, and they will continue to do that work. I'm confident of that. We are in very detailed discussions about what that busiest period of the year looks like. Some of the restrictions we have with warehousing at the moment is a challenge. That's what the industry tells us. Not right now, but it will be a challenge later. So we continue to work with them to try and refine those things, and their feedback goes directly into the most senior levels of the government, the public health team, and we work through that. So I'm confident we'll find a balance point that sees everything we need on the shelves, whilst also making sure that those warehouse settings particularly, which have been high risk, are as safe as they can possibly be.
Premier, just on that mystery case of Echuca,
Yes.
if it can't be found the source for that, is it fair that the rest of regional Victoria stays in the restrictions and doesn't progress to an easier step?
Well, I think the most important thing is to thoroughly investigate and bring a level of not just a kind of a theoretical knowledge or a theoretical approach to this. We will investigate that matter as thoroughly as we possibly can and try and understand as much about that case as we can. I want regional Victoria to take not just one step, but if the numbers allow 2 steps, and we're doing a power of work at the moment to be ready for that. That can occur next week, but we'll have to really, and that's why, as Alan said, there's been a team stood up to look at that in fine detail, try and understand exactly what's happened there. There's retesting, there'll be other community testing, and I'll be grateful to everybody in the Echuca community. If you've got any symptoms whatsoever, please come and get tested. That'll give us a really clear sense of what we're up against there, and it's too early for us to be able to say.
You've mentioned you've considered putting the Geelong corridor previously separate to the rest of regional Victoria. If other regions like this and the Echuca case have mystery cases, will you consider dividing up the regions elsewhere?
Well, we'll have to have a look at that at the appropriate time. I don't want something that's occurring on one side of the state to necessarily impact rules on the other side of the state. And as I've said a few times now, if we had, if we'd forecast that it would take 8 to 10 weeks, something like that, 6 to 8 weeks, whatever the time, a longer period of time, to see regional Victoria take those steps forward, then we would have divided regional Victoria up. That is not in fact the case. We are on track at 4.7. We are on track. Let's deal with that Echuca issue, and be in no doubt there's a very significant amount of work going on to properly understand what sits behind that and whether there's any more virus in that local community. And we are poised to be able to take not just one but potentially 2 steps as early as next week. That is a very different thing than saying to regional Victoria you'll have to wait 6 or 8 weeks. That's not what we're asking. I think the plan is working well. Let's get to the bottom of that Echuca matter, and hopefully next week we can have some very good news for regional Victoria. And that's the best way to thank them for everything they've done. It's the best way to congratulate them for everything that they have done. And that's to take those safe and steady steps and to find that COVID normal.
Given how large Victoria is, though, given how large Victoria is, and that you've made it very clear you won't have restrictions in place that are a day longer than they need to.
Yes.
What would be the only thing stopping you from breaking out regional areas if this mystery case isn't resolved?
Well, I've gone through this a number of times, but I'm happy to do it again. If you divide regional Victoria into a number of different zones, then you have to police each of those borders. You then have to make sure that.
Police enforcement issue
No.
then?
Let me finish. That's the first point. In no particular order. Second point, you can't have a situation where people from an area that is considered to be higher risk are freely travelling into other areas, and that's how patterns of movement work.
If we patrol Melbourne's borders, why can't we patrol other borders?
Well, I suppose the question becomes, if you were to have 6, 8, 10 different zones, that is very, very challenging. Plus, of course, the science tells you, the data tells you, that we're on the cusp of regional Victoria being able to take that step anyway. So this is a rather academic exercise. I'm not asking regional Victorians to wait 3 months or 2 months. We might be able to take these steps as early as next week. So given that it was such a short time frame where we were confident we could reach these triggers, the notion of dividing up regional Victoria for 1 week, people would barely be familiar with the rules before we simply took them off and said all of regional Victoria can open. I don't think that is a bad thing. I think the notion of regional Victoria moving together as one is exactly what we want. Not in 6 weeks' time, but as early as next week. And that's why I'm so proud of every single regional Victorian for doing the amazing job that they've done. But it does speak, I think, to, we've made this point a few times as well, some communities, and I can understand, if there's a notion that, we've had no cases. Why do we have these rules? Well, whether it be Apollo Bay and wastewater testing finding traces, or Echuca finding a case, no cases that we know of. That's the key point here. This thing is silent, rapid, and some people can have it and the symptoms are so mild they don't even register. So that's the real challenge here. But I'm very confident regional Victoria can move and take steps as one. That's as early as next week. That is exactly the strategy working. And it's something that every regional Victorian should be very proud of. And if I might just finally make the point that we will have more to say next week about some changes and some even further measures to make sure that Melbourne regional Victoria border is as hard as it can be. Because one thing, the consistent feedback from regional Victorians, whilst they love to have tourism, for instance, and lots and lots of movement, they jealously guard the low virus status across regional Victoria, and they want that protected, and that's exactly what we will do.
Is there a chance that some outer suburban local government areas of Melbourne with low case numbers could be included in regional Victoria, or are you?
Yeah, I have seen some. I have seen some suggestions that, for instance, we should just lock up the north and the west of Melbourne, where we have the greatest concentration of cases. I just want to be really clear about this. As hard as these lockdowns are, they are not a total lockdown. There are still reasons to leave your home, and there are still people who are going to work. And unless we're going to say to entire communities, literally no one can leave their home for any reason, or no one can leave the postcode for any reason whatsoever, you would still see movement. And that just poses, in the view of the scientists, the experts, and I think common sense tells you, you lock down half a dozen postcodes in the north and the west. Well, there are nurses who live there and work elsewhere. There are doctors, there are teachers, there are ambos, there are supermarket workers, the list goes on and on. So, the judgment is that sort of segmentation won't work, because the border won't be hard enough. You won't be able to limit movement.
Can't you just shift the border in, so say rather than have
Yeah, I have seen that as well.
in
Yes,
regional rather than metro?
Yeah, I have seen that as well. And again, those borders are very well understood. Whilst not everyone would necessarily agree with that, I think it's very complicated and it's potentially risky to be fundamentally altering that border between Melbourne and the regions. We are using the current borders that are there. That's what's guided us all the way through, and I don't have any announcements to make about changing the edge between regional Victoria and metro.
Have any regional councils with 0 cases approached you or health authorities about and suggested ways in which that they can reopen earlier?
Well, I think the important thing here is to acknowledge that we're now getting into a situation where this notion of earlier would be like today versus Wednesday, Thursday next week. So I think whilst everyone would like to be open yesterday, we are on the cusp of regional Victoria as one unit moving to the next step and potentially taking 2 steps as early as next week. Now, I know I've said that a lot today, and I don't want anyone to interpret that that's locked in. We have to be guided by the numbers, but the trend is with us. This one case in Echuca is of significant concern, but we'll do the work, that detailed investigative work, to try and understand as much as possible about that, and then make not just a quantitative judgment about that one case, but a qualitative judgment about what risk that potential mystery case poses.
With the nuanced approach to the geography side of things, is there any value in having a similar approach in terms of the case number counts for healthcare workers? They're obviously at more risk than the rest of us in lockdown. If they're going to be the ones that are most exposed to this, not to put them out in the cold by any stretch, but should the rest of us be under the same restrictions and rules if it's a separate count?
Well, look, when we get down to smaller numbers still, and we get even closer to a very, very small number of cases, then some of those finer judgments will absolutely come to the fore. So we'll look at the nature of positive cases, the risk they pose based on their very individual and personal circumstances, and where you work would be one of those things. There's more aged care than there is health care, if it's hospitals versus aged care. The aged care situation is in a much better position today than it has been for a long time. But the other point I'd make, though, notwithstanding the point I just made about looking in real detail about the individual circumstances of each positive, but nurses live in families too, and they travel home and they move around and they do lots of things. So the notion that your workplace it kind of defines you from start to finish. You've got movement. You absolutely have to have movement, and arguably some of those people are moving around more because they need to in order to perform the critical functions that they perform. If the other way to answer it, I think, is look, if we could just change the rules in aged care or hospitals and have confidence that that would pull it up and everything else could open, then absolutely, like we would make that choice and we'd make it quickly. But that's not the advice. And the other point I just make finally is that aged care is pretty well locked down now. Like there's a lot of people not working at more than one site. ADF are out there visiting, making sure everything's up to scratch. All of those things. So it's a very different aged care setting and a different hospital setting as well than it's ever been.
On aged care, Premier, with the response centre, does that have a timeline? Is that like a finite timeline where it's going to wrap up?
No, I don't believe so. I think it's based on need, and I think that aged care will pose a risk. Those settings will pose a risk for a very long time. Whether those arrangements, which were crafted in the midst of a crisis, whether they need to be enduring, I'd probably have to take advice on that, Noel. But there'll be an underlying risk in aged care until we get a vaccine. That's the fact of it. So there'll need to be vigilance, there'll need to be a really coordinated approach, and that's exactly what we've done. Not so much concerned about who you work for, what government you're from, what side of politics you're from, but just getting the job done there, and the job won't end quickly.
Okay, well, the reason I ask is that we've heard a suggestion that there's a plan to reduce the staffing, and that the Commonwealth official, lead Commonwealth official in the response centre is heading back to Canberra.
I haven't heard that. I'm happy to follow it up for you.
Thank you.
There'll be some in my discussions with Commodore Mark Hill, who is leading the ADF support in Victoria, and to whom I'm very grateful. And on behalf of all Victorians, I've asked him to pass on our thanks to all of his both command, but all of his people. They're doing a great job. and we're very grateful to have them here. They have other challenges, though, later in the year, obviously seasonal weather, cyclones, those sorts of issues. So they've got some preparedness activities they need to do, and they're doing that now. So we'll have a natural easing of the sorts of numbers we've got now. That's perfectly fine, because as these case numbers come down, some of the support that has been essential from, that's just one example, but from other governments, we won't need that. That's why maintaining our team as big as we can is very, very important.
Premier, Federal MP Tim Wilson has asked the Human Rights Commission to examine whether the curfew violates human rights and freedoms. How do you respond?
This is not about human rights, it's about human life. That's my answer to Mr Wilson, and what he chooses to do with his time is a matter for him. Police need rules they can enforce. This strategy only works if we limit movement, and the traffic data I've given you today makes it very, very clear that the curfew does limit movement. If we want our police to be spending all their time having to move people on from Macca's car parks where there are pop-up social gatherings that are not lawful, I'm not going to have police wasting their time doing that. There are very few legal reasons to leave your home. The curfew doesn't change that. It simply means that police have got an easier job. And I think, given the year that Victoria Police has had and the sterling work they're doing, we ought to do everything we can to make their job just a little bit easier.
And you've obviously had trouble pinpointing who came up with the idea. Do those meetings around this have any minutes?
There are cabinet records of all decisions, but I don't agree with the way you have characterised it. Anyone who finds fault with that measure, they can find fault with me. They can find fault with me. Every decision ultimately is something that I'm accountable for as the head of the government. And let me be really clear with you: the curfew position at the moment will not be changing because it is working. It is working. And if you don't limit movement, you won't limit the number of cases. And what everyone wants, to get open and stay open, simply won't happen. I'm always happy to have a debate, but ultimately our policy will not be changing.
Premier, we heard yesterday that Professor Sutton disagreed with the decision to not have him in charge of the overall pandemic response. Why not just put him in charge now, or at any stage throughout the journey?
Well, I think it's really important to understand that the State Controller is a multi-agency coordination function. Dr Sutton has got enough to get on with providing detailed, expert, epidemiological and public health advice. That's where his focus is and needs to be. The role of the State Controller is a much broader role, much broader, and in my judgment, I think that if you had a different arrangement and you were asking someone to both provide expert advice in their primary field, as well as coordination of many things that are well away from medicine and science and public health, I don't think that's the best use of the best skills. The arrangements we have in place are working well. There'll always be debates and discussions about whether they could be otherwise. I don't have the luxury of having those debates. These arrangements make sense, they're working, and regional Victorians are about to see the first dividend, the first significant reward for the amazing effort that we are all putting in.
Okay, so if you're happy enough with that decision and how that's worked, we heard yesterday at the inquiry that Dr Sutton, Professor Sutton wasn't. Does that mean that you two aren't on the same page on this issue?
No, I wouldn't say that at all. You can have differences of opinion. Not that I'm necessarily, I've not read the evidence. I'm taking your word for it on the reporting that, that's what was said by others. That's what they believe to be the case. Again, I'm not a commentator on that process. That process needs to run its course. The arrangements are appropriate, and if that was a view, it's certainly not a request or a view that Brett's ever put to me. He's just getting on and doing his job. I'm getting on doing mine. We work very well together, very closely together, and I think the arrangements we've got in place are exactly the right ones.
Any other differences of opinion of note?
No, what I'm saying to you is that there's an apparent difference of opinion on what he's said to have. His views said to have been, but he's not raised that with me, Noel.
So, are there other differences of opinion that you might want to bring us in on today?
No, I'm not conceding the point that there are differences of opinion. What I'm saying to you is that apparently, I don't necessarily think that testimony was from him, was it?
No.
Right. So someone else thought he thought something, and that might be different to what I like. Really, that's getting a little bit circular. Ultimately, these arrangements are working. They are the right set of arrangements, and I don't have the luxury or, frankly, the interest in trying to work out whether that's a universally held view or not. If you waited for that, well, we wouldn't get much done at all, would we?
Okay, that was the evidence of Melissa Skilbeck
Yes.
from DWHS. Why was Miss Skilbeck moved aside from her role?
It's entirely a matter for the Secretary of the Department. She works for the Secretary of the Department, who in turn works for me. Yes, there's no issue there. But they're not decisions that I'm in any way involved in, any way at all. They are decisions that the Secretary of the Department make, and there are many of those decisions made on any given day.
So did you read about that particular staff movement in the paper, or?
I think I probably did, yeah. Given that I wasn't involved in making that decision, that wouldn't have been something that was drawn to my attention.
Will there be any distance restrictions for regional Victoria on exercise and recreation when things should?
If we move beyond the 4 reasons, and then there's no limits on where you can go. There's some finer work being done. We want to be careful to make sure that people are not doing anything that would put other regional Victorians at risk. I think our biggest challenge, Lundy, will be, not our biggest challenge, our area of real focus, the priority area will be making sure we don't have people from Metro Melbourne without good reason travelling to regional Victoria and potentially taking the virus with them. That'll be the most significant area, and we'll have more to say from a VicPol point of view and some other things that we're going to do. Particularly that Western Melbourne Geelong corridor, that's a real challenge for us, because we know that there's virus in the west of the city, and we don't want that spreading throughout the southwest of the state, and that's why there are a lot of people who move and have to move for the purposes of work and things like that. You know, nurses who live in Geelong and have to come to Melbourne. That's a real area of focus.
So when do you make a call then about potentially taking Geelong out of regional Victoria and including it in the Metro Melbourne bubble? So
Yeah, it'll be done at the last possible moment. So we'll look at the data, and as it stands right now, Geelong is not that kind of problem that we talked about last week, where it could, because it was in a fundamentally different position, it could hold the rest of regional Victoria back. It's not doing that at the moment. That could change. We don't know what the results are for tomorrow and the day after, or even into early next week. But at this stage, we don't think that will be an issue. But we have to be guided by the actuals. As I've said many times, data trumps modelling, and actuals beat assumptions every time. So we'll keep putting those inputs into it, and we'll make some of those finer judgments in due course.
Question for
Certainly.
Alan, if I may. We've sort of bubbled around this week on the case numbers front. I think we've got more cases today than we did on Monday. Is that how you sort of saw it going, or are we plateauing a little bit this week?
Oh, look, numbers go up and down. I think everyone who's been following these numbers carefully knows that Wednesdays always seems to be a bit higher, and that obviously reflects partly the weekend effect and things like that. I think it's coming down. If you look at the 14-day average, it's definitely on its way down, and certainly if you look at where we were a month ago, 700 cases, were significantly down from there. So the trajectory is in the right direction. I think we would all like it to be a little bit quicker, but it's going in the right direction.
Professor Chang, where do you forecast daily cases to be in a week's time?
Oh, look, it's going to be really, it's going to be where it is. I would hope that it's going to be, an average of, getting closer to 50. 40 or 50. It's
the 14-day daily average in a week's time you're referring to?
The 14-day average, yeah. But that's a hope, and we need to do everything we can to keep it down and get it going down as fast as we can.
Given,
Is it going to be hard to do that, given we're still seeing about 50 to 70, if I'm not wrong, healthcare workers are still picking it up? They're driving this charge.
Yeah. Just go back to the numbers I said before. So in the last week of 385 cases total, 89 are healthcare workers. So it's not actually a huge proportion. And as Premier said, healthcare workers are part of the community as well. It isn't just about healthcare workers, and it isn't just about aged care.
Premier, can you update?
Can I just add one thing to what Alan said? The number of patients in hospital coming down is a really important factor in that as well. So the amount of potential exposure because you've got really large. We've got but a fraction of the number of people in hospital for COVID purposes than we did a couple of months ago. And if you chart a graph, that's come down a lot. It doesn't. You can never eliminate risk. It's so wildly infectious. Even people that are head to toe in PPE and take all those issues of infection prevention and control very, very seriously. Even some of them are getting this, but I think that trend is with us as well, as the total number of people who've got the virus in hospital settings, and indeed in aged care settings, the number of active cases is falling also. That sees the risk come down also. Lundy.
When can business expect to get details of what extra government support might be on offer, given it's been
soon.
Almost a week now?
Soon, we'll make announcements quite soon, and they will be very, very substantial. I can't promise that they'll be everything that everyone wants in terms of the finer detail, but it will be a massive package of important support to get businesses through to the other side of this. And then, of course, there will be, around budget time and in the lead up to the budget, there will be very, very substantial, in fact, unprecedented amounts of investment to drive confidence, to drive jobs, and to see us repair the damage that this global pandemic has done, not just to the Victorian economy, but to Victorian communities.
Have you finalised that business support package yet?
No, that's still being worked through.
So what are the areas that you're still trying to lock down?
It's a very good question, and I'm sure I understand completely why you asked that, but if I was to go into all those details, I might well be announcing the package, and it's not ready for me to do that yet, but I will do that soon. And we know and understand that people are eagerly awaiting that. There's been a lot of consultation with industries, not just those who are hardest hit, but indeed across the board. And we will have more to say about that soon.
Premier, it's nearly the weekend, and we got low case numbers. Any chance of you taking a day off? Let another member of the team step up, maybe.
Thank you for the question, Noel. I'll be here tomorrow, and I'll be here the day after, and that's a very important part of the job I have. As I've said a few times, and I don't do this for praise, and I don't do it to elicit concern. Although thank you, I do it because I've got the top job, and I need to make sure that everyone knows that we're all working as hard as we can. And that's what we're all doing. And no one's pleased to find ourselves in the situation we're in, but you can't deny the reality. You cannot deny it. You can't open up too soon. You can't fritter away everything that Victorians have worked for and built and given these last few months. That's got to count for something. And I'm determined that it will. It'll count for a COVID normal that we can lock in, open and stay open. That's what we're going to deliver, and day by day, we're all working as hard as we can to deliver that outcome. I've never asked in my life, I've never asked people to work harder than I do, and I never will. So that's why I'm here every day, and that's why I'll continue to be here every day.
Okay, but what would be the downside of maybe letting Minister Makakos or Merlino or one of your other?
I think we're getting into commentary more than anything else, and I'll leave it to you to make judgments about those sort of things. It's a big team. It's a big team. We all work together. Jenny's here today. Alan's here. Brett will be here tomorrow, I think. I'm not sure what minister will be up with me tomorrow, or if there will be one. We'll wait and see. There'll be ministers here. They're all working very hard. It's a big team. I've often said, if only this hour and a half was the only hour and a half I had to work every day. It's not. There's much as I enjoy it. There's lots of other things that have to happen, and whilst other ministers aren't necessarily standing here every day, they're doing lots of other things. They're working very hard as well, very, very busy. So again, that's my position.
Are you worried that on that front though, that the same person saying the same thing day after day, that message starts to wash over people?
I don't think so. I think that if you look at the numbers falling, you look at the fact that the strategy is successful, it is working. And we're about to see the biggest rewards for our collective effort in regional Victoria in just a few days' time, potentially. I think that people are doing an amazing job, and I'm very grateful to each of them for staying the course. Doesn't mean people are happy to find themselves in the position we're in, but they know and understand deep down that this is the only way we can do it. If you open up too fast, you will not be open for very long, and that's not a smart thing to do. It's also not leadership. It's something very different to that.
Premier, just on that media reach poll in the Herald Sun today of those 5 marginal seats Labor currently holds. It shows that if there was an election tomorrow, you guys would lose those seats. Does this show that people are starting to turn on the government and its handling of the virus?
I wouldn't say that at all. I'd simply say to you that now is not the time for party politics, and it's not the time for party political polling, and you probably should speak, I think, to the people who paid for that and ask them to explain to you why that's the best thing to be doing at the time. I really don't think politics, this is not a popularity contest, this is a global pandemic. I don't think politics and doing what's popular is what we need to do. We need to do what is right, and that's the leadership that I offer. So I've got no comment to make on that beyond what I've just said.
There's talk of perhaps another protest this weekend at the TAN. The organisers are saying it will be peaceful, but will not under any circumstances be cancelled.
Well, then Victoria Police will, as they did last week, they will take the appropriate steps. Now is not the time to be protesting. Now is not the time to be protesting. It is not safe, it is not smart, it is not legal. All you're potentially doing is spreading the virus, and you know, it's a selfish thing to do, because what we all have to do is follow these rules and get through this, get to the other side of this. And the only way to do that is by making smart choices, choices that have a very low risk of spreading this virus. None of us should be doing anything whatsoever that might contribute to more virus. We want less cases, we want less virus active out there in the community, and then we can have less onerous rules. We can open and we can stay open. So the only thing anyone should be protesting against is this virus, and the way to do that is to follow the rules and drive these case numbers down as low as possible, because that's the only way we'll keep them low. Common sense just tells you, you open up with 30, 40, 50 cases and then say to all of our team, by the way, can you just keep those numbers to 3 or 4 a day, please? It's not going to happen. You've got to get them low to keep them low. And protest activity is not compatible with that. Any other?
More?
Yes, Noel?
Off topic, learner drivers. They can't get enough. They can't get enough
Yes.
hours behind the
It's
wheel.
a very significant challenge.
During the. Is
So
there any
hours
chance
behind
we
the
could
wheel
maybe-
and also testing. So even those that have got the requisite hours, I have one such L-plater in my household who neither has the hours or would be able to book in a test even if he did. And there's many tens of thousands. I'll come back to you actually with an exact number. It's much more than that actually. So there is a backlog there, and we're going to have to look at different arrangements for testing. We're going to have to make some very difficult judgments about do we stick with the current hours that need to be done, all of those things. I'm not foreshadowing a different position, but we're looking at all of those things because we want people to have that freedom and that mobility, the sort of independence that comes from getting their Ps. It's a big, big challenge. Well, you may finish up with tests being conducted in very different ways. Much like school exams, for instance, will look very, very different. There's all sorts of different things that we're looking at there, but it's a very significant issue. Any other issues? If not, thank you all. We'll see you tomorrow.